When we think about our pulse, it's something that many of us take for granted. We know we have one, we're alive, but we don't think about it much. And so we're going to go over a few things related to pulse today, and by answering a few questions. What is a pulse? Basically, when the left ventricular pumps blood into the arteries, their elasticity causes them to expand as they receive the oxygenated blood, and this expansion then is called pulse. The pulse should be rhythmic and known to be such, felt to be such, seen to be such. What is a normal pulse? Well, the average normal pulse is between 70 to 80 beats per minute. Now, there are things that can affect normal pulse. The average person has between 70 to 80 beats per minute, but beta blockers can affect a pulse. Someone with hypertension is going to have a higher pulse rate. Those with hypotension or those who are in very good physical health can have a lower heart rate. Some of them as low as 60 beats per minute can be common if they're exceptionally fit. A resting heart rate of 60 beats per minute. So we know what a pulse is as the left ventricular contracts and pushes blood out to the arteries expand, and it's this expansion as they receive the blood that's called the pulse as the heart keeps pumping the blood. We know what a normal pulse is. Now, where would you find the pulse? There are many places to check for a pulse, but the best place to look and sense a pulse is where an artery lies on top of a bone, so that you can then press on the artery over the bone and feel the blood as it's pumped by there. Basically, the palpitation of an artery over a bone is the best place to check, and the pulse is strongest and easiest to detect in the arteries that are closest to the heart, where the blood's coming out. Common pulse checkpoints then. We think first of all, very commonly, of the wrist. When taking a pulse, you need to use your index finger and middle finger, place it on the artery over the bone, and apply light pressure. You certainly don't want to apply so much pressure that you're actually stopping the blood flow, but light pressure there to feel for it. Never use your thumb to do this, because your own pulse rate in your thumb will interfere with feeling the pulse rate of the person you're trying to determine whether or not they have a pulse and at what rate their pulse rate is. So at the wrist, on the radial artery, is a common place where these fingers are placed and felt over the wrist bone. At the medial inside of the biceps on the brachial artery is a place that can be checked. And then one that we see a lot in TV and movies, of course, is on the neck, just outside the larynx at the common carotid artery. So again, the two fingers pressed there with pressure enough to feel the pulse, but not so much that you're cutting off blood supply. Then the way you determine someone's pulse rate is you don't have to feel it for a full 60 seconds. You basically hold your fingers there over the artery, counting their pulse for about 15 seconds, and then you multiply by 4, and this will give you their average pulse rate. So we've answered the question of what pulse is, what a normal pulse rate is, where and how you determine pulse, these common places of wrist, bicep, and neck, and then how long you need to actually feel someone's pulse in order to get their beats per minute. If this is something you'd like to learn more about, then please click on the link underneath this video. It'll take you to a website where you can get more information, and on that website you'll also find a link to an ebook that's ready for immediate download.